name is Yesenia and I'm going to be your student nurse today. How are you feeling?
Good, thank you.
Perfect. That's good. So first of all, I'm going to go ahead and start show you my piece of paper. It is a blank piece of paper. And then this board just has some scribbles on it and the back. Alright, so we're going to go ahead and do a headshot assessment. Before I begin, I'm going to go ahead and put my gloves on. Do you have any latex, medication, food allergies, ma'am?
No.
Perfect. Go ahead and put my gloves on. So how have you been feeling today?
Pretty good.
Oops. Paper's over there flying. Alright. That's great to hear. Of course, this head-to-toe assessment might be a little bit personal, but if you ever have any worries, just let me know, alright? So first of all, I'm going to go ahead and provide some privacy.
Okay.
And then I'm going to go ahead and get your name and your date of birth.
Mary Flores, September 8, 1990.
And then I see you don't have any allergy bands as well. Perfect. And you weren't allergic to medication, environmental, food, anything like that, right? Perfect. Okay. And then medications either, right? Okay, perfect. So we're gonna go ahead and get some of your data. You said your name and then your date of birth. How old are you, Mary?
29.
And your address?
123 Stately Drive.
And your marital status?
Married.
And then your phone number?
435-256.
Perfect. Okay. So what brings you to the hospital or clinic
My
today?
head hurts.
Your head hurts. Okay. And can you tell me from the time it started till now?
It started last week and it still hurts.
Okay. Okay, so I'm gonna go ahead and do a pain assessment for you.
Okay.
What makes it better or worse?
When I take a nap.
Okay. And what about the quality? Is it sharp, dull, stinging,
Sharp.
aching? Sharp. Okay. And then the region, can you show me exactly where?
It's right here.
Oh, okay. And then on the scale of 0 to 10, 0 being no pain to being the worst, where would you rate it?
Probably like a 4.
Okay. And then does it come and go or is it constant?
It's pretty constant.
Constant, okay. And how has this been affecting your daily life?
Doesn't really affect me. I just get a headache. Just hurts.
And does it radiate anywhere else?
No.
Okay, perfect. Okay. So you did tell me what made it better or worse. What did you say?
Laying down.
And laying down. Okay, perfect. Okay, so we're gonna go ahead and get some more data about you. Do you have pain anywhere else?
No.
Perfect. Okay. I'm just gonna get some data about you. Do you have any chronic illnesses such as diabetes, depression, heart disease?
No.
Okay. Do you have any childhood illnesses such as mumps, measles, or chickenpox?
No.
Do you have any previous accidents or injuries such as auto accidents, head trauma where you got unconscious, or burns?
No.
Perfect. And I already did ask you about your allergies. Okay. Now I'm gonna go ahead and get you a little bit about your family history. Do your family have a history of diabetes, heart disease, hypertension?
No.
Okay. How are your mom and your dad?
They're healthy.
Healthy. How old are they?
52 and 54.
52, 54. And their health, is it good?
They're good health.
Okay, so that was a little bit about your family history. Now I'm going to go ahead and ask you a little bit more questions about yourself. Okay, I'm going to go ahead and do a functional assessment. What's your lowest grade of education you completed?
Some college.
Some college. Is your financial status adequate for your lifestyle?
Yes.
Do you have any self-care behaviors?
No.
Okay. And is there any religious practices that we should know?
No.
Okay, perfect. So I'm going to get some more data about yourself as well. How do you sleep at night?
I sleep pretty good.
Take any naps during the day?
No.
And then can you tell me a little bit about a typical day of yours from by the time you wake up to sleep?
So I wake up, shower, eat, go to school, come home, make dinner, clean, and do homework and go to sleep.
Okay, perfect. And did you participate in any self-care behaviors?
I take walks.
Walks? Okay, perfect. Okay, so that was her functional assessment. I'm going to go ahead and move down to a alcohol assessment. Do you smoke or drink alcohol?
No. I don't smoke or do drugs, but I do drink.
You do drink. Okay. On a typical week, how many days a week do you drink?
I drink probably like
Once a week. And on that drinking day, how many drinks do you have?
one.
One. How many ounces is it?
Like 4.
4 ounces. Okay, because you did drink, I'm gonna go ahead and do a CAGE assessment. Do you feel the need to cut down?
No.
Do you feel annoyed when people tell you about your drinking? Do you feel guilty about your drinking?
No.
Do you need an eye opener in the mornings?
No.
Okay, so that was a CAGE assessment. So now I'm gonna go ahead and do a mental health assessment. Sorry, not a mental health, I'm gonna go ahead and do a depression assessment. Okay? Depression, suicide. In the last 2 weeks, have you felt hopeless, down, depressed?
No.
In the last 2 weeks, have you felt less pleasure in things that you used to do?
No.
Okay, and if she would have said yes, I would have went ahead and done a PHQ-9 test. And the 2 questions I would ask her is, do you feel like hurting yourself now? And if you felt like hurting yourself, who would you talk to? Okay, so now we're gonna go ahead and do a violence screening. Because domestic violence is so common in today's society, we ask every individual these questions. Do you feel safe at home?
Yes.
Has your partner ever punched, hit, slapped, or kicked you?
No.
Okay. And if she would have said yes, I would have went ahead and done a danger assessment. So now we're going to go ahead and do a mental status assessment. Okay. A, B, C, and T. So we see that her appearance is good. She has good body movements. We see that her dress is for this season. It's accurate for the season, appropriate for the season, I'm sorry. And then hygiene and grooming is also good as well. Okay, so for B, we see that the patient is alert. She has good speech. It's not slurred, slowed, or too fast or anything like that. It's clear. Okay, for C, can you tell me, she was able to tell me who she was? And then can you please tell me, can you please tell me where you're at and what time it is?
I am at the hospital and it is it is 5 o'clock.
5 o'clock at the hospital, 5 o'clock. She is oriented to place and time. Okay, and then can you tell me, and then we see that she does have a good attention span. She has good remote and recent data. She has been telling me, about her past and of course about her recent data as well. So that's good remote and route. And then we see that the patient does make sense, and then she was not suicidal. So there that goes. Okay, and give me a second. So danger assessment, PHQ-9, and CAGE assessment, all that. Okay. So now that we got that, I'm gonna go ahead and get your vital signs.
Okay.
Okay. We're gonna go ahead and start with your blood pressure. We do not have alcohol, but I would have sanitized everything, including my stethoscope and my pulse oximeter. Oh, you okay?
Yes.
Which arm would you prefer?
This one.
Perfect. And do you have any PICC lines? We see that you don't have any PICC lines. Do you have any fistulas? Breast axillary surgery that we should know about? Perfect. Okay. So let me see your arm real quick. Perfect. Okay. Oh, sorry, wrong side. There we go. Okay. That feels snug. Perfect. All right. All right. So we're gonna do a 2-step method. And before I do take your blood pressure, have you had anything to drink or eat? Drinking any caffeine, smoked, ran in the last 30 minutes? Perfect, because these could all affect your vital signs. All right, so we're gonna go ahead and do a 2-step method. Stop filling it at 110, so I'm going to go up 110, 20, 30, 40, 140. Okay, so we would let this arm rest for a minute, but we're going to go ahead. Does your arm feel okay? We're going to go ahead and check it. All right, so we're going to go ahead and put this on and hold it. So I'm going to go ahead and rise all the way to 150. Oh, 140. Okay, I got 110/82. Is that your normal blood pressure? Okay. Any 20-point difference of greater than 110/80, I would go ahead and call the physician. Okay. So before I start taking more vital signs, I'm going to go ahead and tell you the normal lab value and the normal vital sign range. So blood pressure is less than 120/80. Oxygen is between 95 to 100. Pulse is 60 to 100. Respirations are 12 to 20. And we already said blood pressure. Temperature is between 96.8 to 100.4. Okay. Alright, so that's blood pressure. I'm going to go ahead and check your oxygenation. Of course, this would be clean, and her finger. Can I see her finger real quick? We see that she doesn't have any nail polish either. While we're doing that, we go ahead and take her temperature. Go ahead and clean that. Okay. 98.1 is between normal range. Okay. 97 for her oxygen, between normal range, and 96 for her pulse. It's kind of high, but I mean it's still in normal range as well, so that's good. All right. So that was her vital signs. I'm going to go ahead and check her respirations at this point. Of course, we wouldn't tell them, but pretend that we're doing pulse. So I got 9. 9 times 9 is 18, so that is still between good range of 12 to 20. Alright, so now that we took vital signs, I'm going to go ahead and do everything else from standing up. We're going to go ahead and check nutritional status. So I'm going to go ahead and get you to come get your height, your weight, and all that. If you can just please follow me and step on this scale, please. Okay, we see that her weight is 160. Okay, of course, we zeroed it out, and please. We would, of course, take her shoes off and then we turn her around and zero this out as well. We see that she is 5'5". Perfect, okay. And then I'm going to go ahead and check your waist circumference. All right, you just please put your hands up. I'm going to get into your bubble real quick. Okay. And she is at 36. 36 inches, alright? So now that we're out here, I'm gonna go ahead and we're gonna go ahead and do the Snellen chart, alright? I'm gonna go ahead and do this real quick. 3, 4, 5, 6, 7, 8, 9, 10. Okay, we're gonna say this is 20 feet because this is where it's supposed to be. If we could just please stand here. Alright, and then I'm gonna go ahead and give you this flashcard. Perfect. Okay, and if you can please tell me with both eyes, what is the smallest line you can read?
E, D, F, C, P, C.
Okay, and can you please cover your right eye?
E, D, F, C, Z, P.
Can you please cover your left eye?
E, D, F, C, Z, P.
Okay, we see that she has 20/20 vision. If she was less than 20/30, we would go ahead and refer her to a ophthalmologist. And I saw that she wasn't squinting, leaning forward, or misleading or misreading words. Okay. So now that you're up, I'm going to go ahead and do 2 range of motions while we're here. But first of all, can you please walk from there to here, please? Okay. And turn back and walk with one foot in front of the other. Perfect. We see that her gait was coordinated, steady. She wasn't shuffled. All right. Okay. Now we're going to go ahead and do 2 more range of motions. If you could just please come over here. We're going to be checking for spinal crepitus and pain. Can you please bend over and touch your toes? Perfect. We see that she did not have any crepitus. Did you have any pain, ma'am?
No.
Okay, now we're gonna sorry. We're gonna go ahead and check for hip range of motion. Can you please extend your hip? Perfect. The other one. Did you have any pain, ma'am?
No.
And she did not have crepitus. This was her hip range of motion. Okay, so before I begin with my other range of motions, I'm going to explain what passive and active range of motion is. Active range of motion is when the patient is able to do their motions by themselves, and passive is when we move their limbs for them. All right. So you can go ahead and have a seat. Thank you. All right. So right now I'm going to go ahead and calculate my BMI that I'm here before I forget. Oh. 160, which was her weight, divided by 2.2 equals, so kilograms, it is 72.7. Okay. Now we're going to go ahead and do her weight. So her height would be 65 inches. And then we're going to go ahead and do 65 times 65 equals 5. Now I'm going to do 160 divided by 4,225 equals that times 703. A BMI of 26.6. Okay. I'm gonna go ahead and show y'all my work. All right. We see the BMI, the weight, the height, and then the kilograms, and then the height in inches. All right. So that's her BMI. Okay. So the rest of this assessment is going to be the rest of this assessment is going to be pretty physical. I don't remember if I addressed mental status posture, but she is erect. Okay. And mental status, yeah. Okay, I think I got everything in mental status. We're gonna go everything else in this thing is pretty physical. If you feel uncomfortable, just let me know, alright? Okay. So we're gonna go ahead and start with her head. Beginning with her hair, we see that the hair has nice texture, it's not brittle, and there's even distribution, alright? We're gonna go ahead and check for lumps, protrusions, depressions, and any lesions in the head as well. Okay. Everything seems pretty good. Okay. Now we're gonna go ahead and see that her head is normal cephalic. It is proportionate to her body size as well. Alright, so now we're going to go ahead and move down to her eyebrows. We see that they are symmetrical to her eyes as well, and they're equal bilaterally. Okay, moving down to her eyes. I'm going to go ahead and get my pen. What did I do with it? I have it here. Oh, here it is. Alright, so moving down to the eyes, we see that we're going to go ahead and move her eyes. Can you look up for me? Perfect. We see that her conjunctiva is pink and moist, and her sclera is white. We see, can you please close your eyes for me? We see that her eyes are able to close completely, and she doesn't have any swelling, lesions, or anything like that. And her eyelashes are evenly distributed as well. Okay. So now we're going to go ahead and do a Perla assessment. But before I begin, we're going to look at the eyeballs. They don't have exophthalmos or enophthalmos. Exophthalmos is when there's a protrusion of the eyes. Enophthalmos is when they are sunken in, and she doesn't have it both present. Okay. Now we're going to go ahead and do a Perla assessment. Perla assessment means pupils are equal, they're round, and they react to light. Okay. First, we're going to check if the pupils are equal. So we see that they are round, and they're about a 5 right now. Sorry, this fan. Okay. Now we're going to go ahead and do direct and consensual light. Direct light is when you put the flashlight directly into to constrict the pupil, and then consensual is when the other pupil also constricts as well. Okay. So let's go ahead and do direct and consensual light. Okay. We see that the pupil went to a 3, and as we can see, the other pupil as well constricted, so that was consensual. We see that the pupils are round, they did react to light, and then we are going to go ahead and accommodate. Can you please look over here without moving your head? Perfect. We do see that she does, there is positive accommodation as well. Okay, so now that we did the Perla assessment, and we did measure everything in millimeters, we saw that everything was equal, we're millimeters. We're gonna go ahead and move down to the ears. Okay. What we're assessing for is the skin is intact. We see there's no thickening, lesions, redness, or any swelling. Looking at the external meatus as well, there's no redness, discharge, and if there was cerumen present, we would measure, document the amount, the size, and the texture. We see that there's no redness or anything like that. Going to the other ear as well. Okay, no lesions, redness, thickening, or either, and then the external meatus as well doesn't have any redness, swelling, or anything like that as well. No cerumen present. Okay, now we're gonna go ahead and check for tenderness of the ears. Tell me if you feel any pain. I'm gonna pull the pinna back and up. Any pain here?
No.
Okay. Any pain while I push on the tragus?
No.
Okay. And any pain here at the mastoid process? No. Perfect. Okay. So there was no tenderness. While I'm back here, I'm gonna go ahead and do a finger rub test. Okay. Just close your eyes and tell me where you hear the sound. Perfect, okay? So she did pass the finger rub test and she is able to participate in conversation as well. Okay, so now we're gonna go ahead and do some more exams. Are you still okay, ma'am?
Mm-hmm.
Perfect. Okay, we're gonna go ahead and move down to some more tests. So she's gonna test the cranial nerves. Close your eyes, please, and tell me when you feel a sensation.
Go on. Yes. 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 Yes.
Okay, so she does have a good sensation there. We're gonna go ahead and do a smell test. I'm gonna go ahead and occlude one nostril. Please close your eyes and tell me what you smell.
Orange.
Perfect. Now we're gonna go ahead and occlude the other nostril. Please close your eyes and tell me what you smell.
Oh, mint.
Mint. Perfect. So she did have a good olfactory nerve. Okay. Now we're gonna go ahead and do motor. Can you please puff out your cheeks? Perfect. We do see that the air released symmetrically from the mouth, so it was good. Now we're gonna go ahead and do 3 other tests. Can you please cough for me? Can you please swallow for me? And then the gag reflex, we're gonna go ahead. Perfect, but we don't really do it here because people have projectile vomiting. All right, so now that we did that, we're gonna go ahead and finish the rest of our assignments. Okay, so I'm gonna go ahead and move down to the neck. Okay, so we're gonna go ahead and move down to the neck. Let me see real quick, where is my pen light? Can you please move to the right? Perfect. We see that there is no jugular vein distension. Can you please move to the other side? Okay, and there is no jugular vein distension as well. Talking about the veins, I'm gonna have you do some range of motions from the neck. Ready? So can you please follow me to the right, to the left, down, all the way back, and then your head to your shoulder. To your ear to the shoulder. Ear to the shoulder. Did you have any pain there, ma'am? No. Perfect. We do see that the neck is midline and erect. Alright, so now we're going to go ahead and do some more tests on the neck. Okay, my stethoscope would have been disinfected as well. Alright, if you could just please move that way. And then for this exam, I need you to take a breath in, breath out, and hold. Perfect. Okay, I'm going to go ahead and do the other side as well. Okay, breath in, breath out. Hold. Perfect, okay? So now that we got that done, I'm gonna go ahead and finish some more tests. So the neck was good. We could see that trachea is midline and everything like that. All right, so I'm gonna go ahead and do the oral cavity at this point. First, I'm gonna go ahead and move down to the nose. Can you smile for me? Perfect. We see that the nasal and labial folds are symmetrical, and the sides of the mouth as well are not drooping. We're going to go ahead and move down to the oral cavity. We see that her lips are pink and moist. Can you stick out your tongue for me? Perfect. We do not see any white patches or any glossiness. Okay. But yes, we do see moisture. Sorry, it's not dry. All right. And can you show me your teeth, please? Perfect. We see that all teeth are present and there is none missing. All right. So now we're going to go ahead and do some more tests. Can you please open your mouth and move them all around? Perfect. Oh, okay. Yes. So thank you, Mama. Perfect. We see that we didn't have any cryptas. Did you have any pain, Mary?
No.
Perfect. Okay. So now we're going to go ahead and move down and do some more examinations. All right. We're going to go ahead and get perfusion out of the way while we're here. Let me go ahead and palpate the carotid artery. +2. +2. And then, of course, how we grade the carotid artery is the closest is 0 is absent, 1 is weak, 2 is normal, and 3 is bounding or full. So that was +2, +2. Go ahead and move down to this. +2 brachial. +2 brachial, +2 radial, +2 ulnar, +2 radial, +2 ulnar. The femorals we don't do, and then the popliteal pretty hard to find, but we just lift it up. +2, +2. Moving down to the dorsalis and posterior tibialis. Okay. +2 posterior tibialis, +2 dorsalis pedis, other leg, +2 posterior tibialis, +2 dorsal pedalis. Perfect. Okay, so we're gonna go ahead and finish some more things of skin and everything like that. We see that her color is relevant to her genetic background. We see that she doesn't have any freckles, patches, anything like that. We're going to go ahead and palpate for warmth. And, okay, perfect. Can I see your feet, please, ma'am? Perfect. Okay, so we do see that there is good warmth in all places. It's not hypothermic or hypothermic. We're going to see hair distribution on the arms. Perfect. Okay, so we have good hair distribution. There's no patches, as well as for the legs as well. Okay. So we're gonna go ahead and palpate for edema. Edema is scaled. 1 is mild, 2 is moderate, 3 is deep, 4 is very deep. As you can see, we do not have any edema in all extremities. Right? Going down to edema. Oh, let me see your nail beds, please. Okay. So I'm gonna go ahead and check for capillary refill. Okay, that is less than 2, so that is good. And then we see that the nail beds are good as well. They're not cracked, bit into the quick, or jagged or anything like that, all right? So that was good, capillary refill. So now we're gonna go ahead and do some more examinations. We're gonna go ahead and palpate for muscle tone and symmetry, and also tenderness. Okay? So tell me if you feel any tenderness, ma'am. Any tenderness?
No.
Okay. Now for the lower extremities. Any tenderness?
No.
Perfect. Okay, and now we're going to go ahead and ask you about your lesions and wounds. Do you have any wounds or lesions?
No.
Perfect. If the patient would essentially have wounds, we would document the location, the size, the exudate, which includes the color and the smell. For lesions, we document the asymmetry, the border, the color, the diameter, and then the elevation as well. All right, but she doesn't have those present. We're gonna go ahead and do some more examinations. We're gonna go ahead and check for muscle tone and symmetry. Because I did palpate for tenderness, but not muscle tone and symmetry. Okay, can I see your hand? We do see that she has good muscle symmetry and tone in all her extremities. Good symmetry as well. Perfect. All right. So that was good. Now I'm gonna go ahead and do some range of motions. We already did this one. I'm gonna go ahead and do the shoulder. Can you push up against me? One big push. Perfect. So she has good shoulder strength. And now we're gonna go ahead and do some good range of motions for her shoulders. Can you go like this? And like this? Perfect. Go ahead. Perfect. So that was good. Now we're gonna go ahead and do. We did the shoulder, this one as well. Okay. So now we're gonna go ahead and do some of her elbows. All right. Go ahead and move out and good. So she does not have crutches. Do you have any pain?
No.
Does she have any pain on her shoulders?
No.
Perfect. All right. Can you pull up against me? Perfect. Can you push? Okay. She does have good elbow strength as well. Now we're gonna go ahead and go down to her wrist. Can you move them all around? Go ahead. Perfect. She has some crutches. Is there any pain?
No.
Okay. Not for her fingers. Can you follow? Can you go like this? Do you have any pain?
No.
Okay. Perfect. Now we're gonna go ahead and go down to her feet. Can you please kick out like this and this? Perfect. There's no crepitus. And do you have any pain?
No.
Perfect. Okay. And then can you please push up against me? Oh, perfect. And can you pull? Perfect. Okay. Can you please pull my fingers? She has great upper body strength as well. Okay. Now we're gonna go ahead and go down back to her respirations and all that. Whenever I was taking respirations, we did see that she had a good pattern, which means that they were unlabored and they were even, consistent, normal. Okay. So we're gonna go ahead and evaluate the heart, and then the respirations here. So this will be cleaned. So with the diaphragm, we're gonna go ahead and oscillate all points of the sounds that could be heard. Okay. So we have the aortic, pulmonic. We have the Erb's point right in the middle. Okay, can you please lift your breast? We have the tricuspid. And then we have the mitral. Perfect, okay? So all of them were good sound. There wasn't any irregular rhythms, okay? Now we're gonna go ahead and palpate for respirations. So for this one, just take a deep breath in and out. Ready? Go ahead. And then behind. Perfect. So we see that she had good respirations. There was no crackling or anything like that as well. Okay, now I'm going to go ahead and check her respirations on the back. Just please move this way, ma'am. Perfect. Okay, and again, deep breath in, deep breath out. Perfect, okay? So we do see that she had good respirations, everything like that, okay? So now we're gonna go ahead and do 2 examinations. You can take her to the restroom if you want. I don't want her to pee on herself. Sorry, she's gonna take her daughter to the restroom. Okay, so we're gonna do 2 examinations here. Okay, can you please turn back? We're gonna do a test called tactile firmitis. Every time I put my hand, can you please say 99?
99. 99. 99. 99. 99. 99. 99. 99.
Okay, we do see even vibrations in all the backside, alright? Now we're going to go ahead and do another test called the culture-vertebral tenderness. This is checking for kidney inflammation. All right. I'm going to go ahead and put this on your last rib and tell me if you feel any pain. All right. Okay. Any pain?
No. No.
Perfect. Okay, so this was checking for kidney inflammation. Now we're going to go ahead and do another test called chest expansion. All right, so going here on the last rib, if you could just please take a big deep breath in. Perfect. And we see we can have symmetrical, chest expansion on all sides. So turning this way, just right here, we see that she does not have barrel chest. She has a ratio of 1 to 2. Looking at her sternum, we see that she does not have pectus excavatum, which is a depression of the sternum, or pectus carnivatum, which is a protrusion of the sternum. Okay, so that looks good. If she did have barrel chest, it would be ratio 2 to 1 1. Okay, so everything looks fine. Now we're gonna go ahead and do some more examinations. Are you still feeling okay?
Yes.
Perfect. And I don't know if I mentioned the sides of the mouth, but they are symmetrical as well. I did smell, motor, eyes, accommodation, pupils are equal, rectal lines, the sclera, conjunctiva. I think I said the conjunctiva was pink and moist and the sclera was white. Don't remember. Okay, but as you can see, she didn't put it to charge. I'm gonna put this phone to charge, I'm sorry. Okay. All right. So as you can see, we have everything done right here, the sides of the mouth, everything like that. Okay. And there was complete closure of the eyelids. We're gonna go ahead and go back down to okay. So I think that was everything for the chest and the back. Okay. So I'm gonna go ahead and ask if you can lay down over here now. I'm gonna go ahead and move this way. Perfect, okay. Oh, and my camera holder is back.
Sorry.
Here you go. All right, so we're gonna go ahead and finish the assessment of the abdomen. Okay, first can you please move your hands, ma'am? Of course, this patient wouldn't have an undershirt on, but we're gonna go ahead and check real quick. Okay, so we're gonna be looking for venous pulsations on the chest, as well as the stomach as well for the arteries that are present. And we can see that she does not have any shadows, what can be indicative of a mass. Okay, so now we're going to be inspecting. We're going to be inspecting for any striae, the color, any venous patterns, as well as the contour. As we can see, the contour is flat, it's not protuberant, scaphoid, or round, so that's good. Okay, so now we're going to be osculating. Before we oscillate, I'm going to go ahead and name some of the major organs in each quadrant. The right lower quadrant contains the appendix, right upper contains the stomach, the liver, sorry. The left upper contains the stomach, left lower contains the descending column, and midline contains the bladder. All right, so now after we named all those, I'm going to be oscillating, but first I'm going to oscillate the major arteries of the stomach, which are the aorta, aortic, renal, iliac, and then femoral. Okay, so we have the aortic, we have the renal, we have the iliac, and then the femoral we don't oscillate. Now I'm going to go ahead and turn my stethoscope to the diaphragm and oscillate the bowel sounds. Okay, in all four quadrants, right lower, right upper, left upper, left lower. Perfect. As you can see, we have normal active bowel sounds in all four quadrants. They're not hyperactive or hypoactive. All right. So now we're going to go ahead and move down to palpation. We're going to go ahead. No, we're going to do percussing first. We're going to go ahead and percuss. Tympani is air. dullness. It could be indicative of a mass, fluid, even a distended bladder. Perfect. As you can see, we have Tiffany right here. Now we're going to go ahead and do a fluid shifting test, which is going to be testing for ascites. Okay, so starting from here. We would put the line right here because this is when I started feeling distension. The rest of the test goes that the patient will move to her side, which is the left side at this point. We would go ahead and do Tiffany all the way until we felt dullness, put a line through it, and then if that line was greater than the other one, we would it would be that there was fluid, which could be ascites. Okay, so that was a fluid shifting test. We're gonna go ahead and move down and do a percussing. We're gonna go ahead and palpate. I'm sorry. We're gonna palpate for distension and tenderness. If you feel any tenderness, let me know, right? So we're gonna do a small palpation, light palpation, that's what they call them. Okay, right. All 4 quadrants. Okay. All right. So that was good palpation. I do not feel any masses or anything like that. Did you have any tenderness?
No.
Perfect. Okay. So now we're going to go ahead and move down to the legs. We're going to go ahead and do a iliopsoas test. So this is going to be indicative of appendicitis or right lower tenderness. So can you please lift this leg one time and push? Perfect. Did you have any pain here?
No.
Perfect. And if she did have pain, it could have been appendicitis. It could a risk for appendicitis. So now that we tested this muscle strength on this hip, we're going to do muscle strength on this hip as well. Can you push up against me? Perfect. And we see that she has good muscle strength here as well. We're going to go ahead and move down and finish what we left off of over here on the range of motion. Can you please move your ankles? Put them in, put them out. Perfect. We see that she has crampness on actually the right ankle. Did you have any pain?
No.
Perfect. Now we're going to go ahead and do a lower body strength test. Can you push up against my hand? Perfect. Okay. So did you have any pain or anything like that? Okay, so she did have good lower body strength. Lower body strength. Good lower body strength, I'm sorry. Okay, so that was our test. I'm going to go ahead and ask you some more questions and maybe go back to some assignments I might have missed. All right, let me get my paper. All right. So first we're going to ask her about some elimination. When's the last time you had a bowel movement?
This morning.
This morning? Okay. At what time?
8 a.m.
8 a.m. Okay, I'm going to go ahead and ask about some characteristics. Can you tell me a little bit about characteristics of your bowel movement? Were they normal?
Normal.
What size was it? Normal?
Normal.
Okay, and then was it like medium? Yeah?
Mm-hmm.
Okay, and then the smell of it, was it hard to defecate?
No.
Perfect. Okay. If I did have it with me, I would go ahead and document my characteristics and my findings, such as, how large it is, if I see any occult blood or anything of matter. Okay. So now that we asked about your elimination, we're going to go ahead and ask you a little bit about some more questions about mobility. Are you able to get in and out of the house?
Mm-hmm.
Okay. Are you able to feed yourself, cut up food? Are you able to get in and off of the toilet? Are you able to, give me a second, are you able to make it to the toilet on time? Okay. Are you able to dress yourself, button up your buttons?
Yes.
Okay. And then are you able to bathe yourself, move the handles? Okay. 6. So that's a 6 points, which is the maximum they can get, which means that she is very independent. I'm going to go ahead and do 2 more tests. One is called the FAST. One is called the Glasgow's Coma Scale. Okay. So as we can see that her face was not drooping. It was good. And then can you please put your arms out like this? We do not see weakness in the arms or one of the arms going down as well. Okay. And then speech, can you repeat after me? The day is bright.
The day is bright.
We see that her speech is clear, it's not slurred, and then T would be time to call 911. However, she passed the FAST scale, which of course the FAST scale is for stroke, but she passed it. We wouldn't need to call 911. Okay, now we're gonna go ahead and do a Glasgow's coma scale. We see that her eyes open and close spontaneously, so we're gonna give her a 4. We see that her speech is clear. Of course, she just told me about it in the FAST scale test. We would give her a 5. And then for her body movement, she's been able to move them for me, like for her range of motion, everything like that. We would give her a 6. In total, this would give her 15 points, which is a good point. So that means anything less than a 7 would be more of a comatose state. All right. And then I'm gonna go ahead and review more. Maybe I would have missed something. Not really sure. I think I did mention that the ears were bilaterally equal. Range of motion, carotid, arteries, sternum, shoulders, mouth, temporomandibular, shoulders, elbows, hands, the eyebrows, the hair. I did mention texture in the arms. Color. Oh, she's not pale. She's not pale. Cyanosis, red, pink, or different color. She's good with her ethnic background. Let's see. Nasolabial, I did the hearing test. The chin, the neck, the shoulders, capillary refill, the arms, the hips. I did osculate over the arteries for palpations, the feet as well. And I think that will be it. Thank you.